Hello, how are you? Today I brought some tips to help you if you're dealing with constipation, if you've been wanting to have a bowel movement for a few days and can't, because this can be dangerous for your health. It's very important to have regular bowel movements, so I'm going to share some tips that might help you. Stay with me until the end, because you won't want to miss this. If you love tips on nutrition, health, and fitness, you're going to love this channel. So go ahead and subscribe and remember to turn on the notification bell to get updates. I post new videos every day and you're going to love them. Before we get started, I want to remind you that I have two playlists here on the channel that I think you'll really like. One is about digestion and healthy intestines with lots of tips, and the other is about natural laxative recipes. I'll talk more about them later, but I'll leave the links down below in the description. If you're interested in this topic, go ahead and leave your like, because that way I'll know you enjoyed it and I'll bring more ideas, more news, and recipes for you. And by liking the video, you help me out here on the channel, and it ends up being good for everyone. We can spread this positive chain even further. I wanted to make this video because, of course, the ideal is for us to try to prevent constipation through a balanced diet. Everyone knows that to avoid constipation, we need to consume plenty of fiber, natural foods, healthy fats, lots of water, and stay well hydrated throughout the day, cut back on processed foods, red meat, and cured meats. But there are people who have slower, lazier bowels, sometimes because they already have the habit of holding it in when they feel the urge to go to the bathroom. You're out on the street, not at home, traveling, out of town, and you keep holding it in repeatedly. And the vagus nerve stops sending that peristalsis signal, so you end up without the stimulus to have a bowel movement. Literally without the nervous stimulus for your intestines to contract. So there are a few things you can do to try to improve this. Before I start telling you about them, I need to mention that people often get worried when they don't have a bowel movement and wonder if they're constipated. Some people have a bowel movement every day, some go twice a day, some go every other day, and some go one day, skip two, then go again. All of this will depend on factors related to the person's age, intestinal motility, any medications you take, the amount of food you eat, and what your diet is like. So, going more than 3 days without a bowel movement is not healthy for you, because the longer the stool stays in your intestine, the longer it remains in the large intestine, the more water gets reabsorbed, the drier it becomes, and the harder it is for you to pass it. So, if your stool has been sitting there for a long time and it always takes you a long time to have a bowel movement, it's very important that you see a nutritionist, that you see a doctor, get some tests done. You might have some issue related to your intestines, maybe an obstruction, a food intolerance. I have many videos here with tips to help you with constipation, to help you have a healthier gut, but if this keeps happening repeatedly, you need to see a doctor to find out what's going on with you, because regularly going more than 3 days without a bowel movement may not be healthy for you. And maybe in your case, 3 days is normal and the doctor will assess that. But if this happens very often, if you have that feeling that you had a bowel movement but something is still stuck inside, that you couldn't eliminate everything, this could be a warning sign for you. I say this because people who go many days without having a bowel movement, their stool starts to dry out, as I mentioned before, and this can form a fecaloma, and that fecaloma can block your intestine and become a medical emergency, to the point where you might need surgery to unblock your intestine. So constipation is no joke. It's very important that you try to have a bowel movement regularly, at least every other day, so you can eliminate this waste, because you're eating, so it has to come out. It can't all just stay stuck inside. So let's start talking about things you can do if you're already more constipated, if you feel like your bowels are full and you can't have a bowel movement, things you can try to help get things moving. The first thing you should try is to take about 3 or 4 prunes, and you can make a juice with them using a glass of water. Blend it in a blender, don't strain it, and drink it. Prunes naturally contain sorbitol, which will ferment in your intestines and draw more water there. They also have fiber, and this can help you have a bowel movement. So prune juice, and if you want to blend the prunes with papaya, that's even better. When we think about trying to soften the stool, we need to think about drawing in water, because stools are usually drier. Fiber, especially soluble fiber, because it helps bring in more water and hydrate, and this will make the stool easier to pass, and fat as well. Fat will help to moisten the stool, making it easier for it to slide out of the rectum. So, if you can thoughtfully add flaxseed or chia seeds or coconut oil or even a piece of avocado along with sweet papaya, wholesome prunes, and pure water, it will be much better for your overall well-being. It ends up being quite powerful, so it will really get your bowels moving. I have some other different laxative recipes here that you can try. I'll leave this playlist down below in the description for you with some other great ideas. It's always important to remind you to drink plenty of water. Usually people who are constipated, who are dried out, who have hard stools, who have those drier stools, really need to drink a lot of water throughout the entire day. The more water you can manage to drink, the more it will help you improve this as well. A good tip I can give you is to drink this water on an empty stomach, cold, in the morning, because you'll give your pylorus a shock. When your stomach is empty and that cold water hits, we have a valve between the stomach and the small intestine called the pylorus. When the cold water hits there, it contracts the pylorus and gives it a kind of shock, so to speak, and it starts the peristaltic movement, which is that movement that leads to evacuation. If you feel the urge to evacuate, try to go, no matter where you are. Carry tissues in your bag, bring hand sanitizer, use the tissue, use the sanitizer on the street, line the seat, do whatever you need to do, because the more you deny your body the urge, the more you are training your body not to send that signal, and this will worsen your constipation in the long run. Another thing you can do, after you've had your shake, you'll have to wait. It's not instant, it will take some time. Remember, it's in your stomach. It still has to pass to the small intestine, then to the large intestine. So this will take 40 minutes to an hour. Preferably, do this on an empty stomach. It will be better for you because there won't be anything else there to be digested. Meanwhile, you lie down on the bed, take a bit of moisturizing oil, and make circular motions on your belly, just like we do with babies. When a baby has colic or gas, usually the mother massages the baby's belly to warm it up, to stimulate peristalsis. We lift the baby's leg up and down, move it around in circles. Try doing these same movements yourself. Lift and lower your leg. If you are able to, please do some gentle squats. Nothing too strenuous or intense. Just squat down slowly and deliberately to try to effectively stimulate those important intestinal muscles, that crucial part of the lower abdomen and the entire pelvic region, in order to really get things moving and flowing smoothly. If you can, go for a walk. It can even be inside your house. If you're afraid to go outside and suddenly feel the urge to have a bowel movement, just walk around at home. We know that physical exercise really helps a lot with bowel movements, and people who tend to be more constipated are usually more sedentary. There's a correlation there as well. So add physical activity to your daily routine, move your legs, move your abdomen, because that also helps stimulate peristalsis. Another important tip to consider, when you find yourself needing to go to the bathroom, our Western-style toilets typically have us sitting with our legs positioned downwards and our hips elevated a bit higher up. And this particular posture is, in fact, not actually the most physiological position for us. The most physiological position would be to squat, like indigenous people do, like people do on the ground, but that's not possible here. So please grab a stool, a piece of wood, a poof, whatever you might have available, and then place it directly in front of you to elevate your legs. Ideally, your knees should be positioned above the toilet seat, so you can mimic that squatting position, because physiologically it will be easier for the stool to be expelled and with less pain, since the stool will likely be harder and may cause some discomfort. So ideally, you should raise your legs a bit to improve this alignment and make it easier to pass stool. When you feel the urge to have a bowel movement, try to control that urge and go slowly, evacuating little by little. It's possible that at first the stool will be larger, drier, and may actually hurt a bit. You might get a fissure or see some blood. This can happen. There shouldn't be blood when you have a bowel movement. And if you regularly see black or red blood, you need to see a doctor. But at this moment, because the area is sensitive, the tissue is thinner, and the stool volume is greater, it might cause some injury. And if that's the case, it's a good idea to ask your doctor about an ointment you can use. Sometimes even a baby ointment can help. Clean the area well, wash with soap and water, apply an ointment, and if the injury persists for a few days, it's very important that you see a doctor so they can help you. Be sure to mention that you were constipated and passed a larger volume so the doctor can better understand the situation and determine which ointment is best for you. Another thing that can help you, and doctors usually recommend this after you've already tried everything I mentioned, is a glycerin suppository. You insert the suppository into the rectum, lie down, and wait about 20 or 30 minutes for it to dissolve. If you insert the suppository and immediately go to the toilet, you'll just expel the whole suppository without it working. So, you insert the suppository into the anus and wait about 20 or 30 minutes for it to dissolve because the glycerin softens the stool. It attracts water, increasing the water content in that area, moistens the stool, and can make it easier for you to have a bowel movement. Now I want to tell you, if you tried all of this, drank the juice, did the massage, tried to improve your leg position on the toilet, did some exercise, went for a walk, used the suppository, and still didn't go to the bathroom, still couldn't have a bowel movement, Go to the doctor, go to the emergency room, because it may be necessary to have an enema, which is that intestinal wash they do at the hospital to remove that hardened stool. I told you that this hardened stool can be dangerous for you. There are even serious cases, I won't even get into the details of severe problems here, that can even lead to death, but let's not panic right now. Just remember that if you haven't had a bowel movement for a long time, 5-7 days, this can be dangerous for you. And if you feel unsure, go to the doctor to seek help. Of course, the best thing is not to let it get to that point, so if you already have a slower bowel, keep up with physical activity. That will definitely help you. Set a specific time to try to have a bowel movement. Every day you can try sitting down at the same time to go. Make it a habit to drink a glass of cold water every morning. This can really help improve your peristalsis. And follow a gut-friendly diet with probiotics. I have a video here talking about probiotics, which really help with dysbiosis, which is often also a cause of constipation. Lots of fiber, healthy fats, and plenty of water will help you with constipation. Don't let it get to that point, because this way you'll suffer less and it will be better for your overall health. Tell me down below if you have any home remedies, what you do when you're more constipated, what helps you get relief and be able to go to the bathroom. I would love to see your comment. Remember to like the video, it really helps me out, and share it with anyone who might enjoy it or needs it. Let's work together to grow this chain of good. That's what I want here with the channel. See you next time. Bye.